Hi, my name is P.A. Clark. I am a facial aesthetic specialist and pioneer in facial rejuvenation using the best products and the latest techniques to keep my patients happy. We will be talking about facial beauty and what is possible with non-surgical facial rejuvenation. At Dermaworks Med Spa, we deliver amazingly natural, life-changing results. We help you consider what's possible and work with anyone wanting to reverse the visual signs of aging, but best of all, our results last. Janice, one of my good patients, comes into the office complaining about her jowls. Now, this is something we've spoken about many times, but that day, she was ready to work on her jowls. What happens is we have a pouch of fat within the face, right? So that fat tends to get full, sometimes it tends to fall. And as it falls, it goes over the mandible bone and creates this bulging that we tend to not like. Jowls are not bad. Everyone gets jowls. So Janice's issue was that when she takes pictures, she's seeing the shadowing and she's seeing the bulging, and she's not looking quite like herself. She's not looking like the type of person she remembers. And that happens. I mean, it happens to myself as well. Jowls are something that we can work on, but you have to be careful what is being done. So in this topic, we're going to talk about how we work on jowls. We know that Botox or Dysport relaxes muscles, so that cannot fix the jowls. We know that fillers help to create volume and lift and width and height, and that's great, but that cannot fix jowls. Remember, jowls are here and it's expanding, so you can't have a filler that's also going to expand the jowls. What are we left with? We have our dermal threads. Dermal threads act to pull gently, lift the cheeks, lift the jowls, lift the jawline, lift the eyebrows. But in Janice's case, it was just the jowls. So one thing I've always said is you cannot sleep on your face. If you do sleep on your face, you will accentuate the jowl. You will pull the skin down. You will create more fullness under the jawline, and that's what jowls are. So for Janice, just like many of my patients who come for that lower face rejuvenation, we talk about some possible treatment options. One option is surgery. Now you can have a facelift that's going to pull the SMAS layer. The SMAS layer is the muscles behind the skin, and those muscles are used for expression. So when you pull that SMAS layer during surgery, you're tightening the face. Now, not everyone wants a tighter face. Sometimes it can make you look gaunt or too hollow. In this case, it wasn't the right choice for Janice because her face was still pretty good. She wasn't ready for surgery. She just wanted to take care of the jowly kind of the pouching fat just by the bone, just on the corner of the lips underneath the mandible here. Therefore, the best choice is going to be the threads. So we did discuss threads, and for Janice, threads was the way to go. Now, speaking of threads, there are different types of threads. Now, some threads come thicker, some come smaller. Some threads have hooks, some don't. Some threads are spiral, some threads have many filaments coming out of that needle. Threads are different, but using the right thread, which is called barb threads, can act to grip the tissue and pull depending on the angle that your injector uses to completely eliminate the jowls. So finally, it was time for Janice to have her jowls done, and I went over the entire scenario of what the treatment is going to be like. You're going to have some numbness. We're going to clean very well. We're going to insert the thread and position the fatty tissue where it should be. afterwards we're clean, we'll smoothen the area, and you're gonna have some soreness, you're gonna have a little bit of swelling, not too much, but you're actually going to leave my office without jowls. So what does that mean? Does that mean that automatically I come in with jowls and then I don't have jowls? Yes, absolutely. You come in with jowls, you leave without jowls. Why? Because I am repositioning those jowls upward. Now it's not just as simple as doing Botox, Dysport, or fillers. Jowls take years to learn to do. And if not done well, you're left with pockets, dimples, rippling, or even weird indentations for more than 1 year. You don't want to leave your practitioner's office looking worse than you came in. You must always leave better than you came in. That is the mark of a good treatment. So if you leave the office swollen, red, bruised, if you leave looking worse, that was not necessarily the most atraumatic treatment or the best treatment for you. And that's just a rough gauge for you. So threads will definitely work to lift Janice's jowls up. So we do know that surgery works great depending upon the individual, but more and more patients are tending to have threads done because they are less invasive. That is one of the major benefits of threads. You can leave my office and return to work the next day after having your threads done without the jowls. Threads in good hands can last 2+ years, even up to 3 years. I've had patients many years after and still looking better, because threads don't only pull, but threads, dermal threads, rejuvenate the surface layer, the deeper layer, which is the fat, but also the muscle. So once you reposition the tissue, you are actually reprogramming the tissue in how the tissue is aging. Threads are one of those things that will definitely make a huge difference in your life when we're talking about the lower face. And more importantly, when it comes to the lower face, it will almost definitely be the jowls. So the biggest benefit in jowls is you can come in and you can leave the office having a really, really nice exit appearance. Now you're gonna have some soreness afterwards, depending. Why? Because we're positioning the threads, we're also locking the threads. After we lock the threads, there's nothing you're doing that's gonna take that tissue off except for sleeping on the face. So don't sleep on your face. For anyone who is unaware of what threads are sutures. So if you, after having something like abdominal surgery, the surgeon can't go back in and remove the threads. The threads are there, but the threads are not permanent. The threads dissolve. So once these threads are dissolved, the body eliminates those threads. And it takes about 6 to 8 months for the threads to be dissolved. And again, they're called PDO threads, which are really surgical sutures with little hooks on the surface of the thread that grips the tissue. Very, very simple concept. Threads pull, grip, and hold the tissue in place. So it allows everything to blend really well and adhere upward. And that's what youthful faces are. Youthful faces have upward mobility, but also upward traction. As we get older, we have cutaneous ligaments that attach the skin to the bone. Those ligaments stretch as you get older, and so the tissue falls. More importantly, it's the lower face that shows the most fall as we age. So threads are there to create kind of a scaffold to kind of pull and lift everything back up. So there are major benefits to threads. The most disadvantage to the threads is who is doing your threads. Always be careful of who's doing the threads. If threads are not done appropriately, and you can find this online, you get dimples and holes and everything else that we don't want. So be careful who touches your face. Dermal threads are the way to go in terms of lower face, traction upward, and rejuvenation. We know toxin doesn't do it. Fillers doesn't really do it that well. So threads are the only other option, and it is the best option. If you're thinking about having dermal threads, drop us a comment, follow us on Instagram, look at our before and after pictures. There's a wealth of information on dermal threads, PDO threads.